Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I am joined by Dr. Tarin Forbes. Welcome, Tarin.
Thank you so much, Lisa, for having me on your podcast.
I'm so excited to have you on my podcast. So first and foremost, Dr. Forbes is my personal physician, and I've been seeing you now for 2 years, and I just can't tell you the difference in the level of care that I feel like I have received in my entire life. Like in just my experience with you and your team has just been amazing. So I know you own the Forbes Longevity Center, and your specialty is definitely in family medicine, integrative, anti-aging, and regenerative medicine. And I just can't wait to kind of have you share your journey on how you got to where you are today, and really to talk a little bit more about your practice and how you are caring for patients in a very different way, and and how it's impacting people's lives. So let's just jump in and have you give us a little background on you and your journey.
Awesome. Well, thank you so much for that awesome introduction. And it is an absolute honor taking care of you. So yes, no, I'm a longevity doctor, like you said, and I take a very functional medicine and integrative approach to my patients with the ultimate goal of making their health span match their lifespan. But yes, my background did not start in integrative and functional medicine and regenerative medicine. It started as a family medicine physician, and I felt like I was always into wellness and nutrition and preventive medicine, but I felt that my medical school and my residency both did a disservice in regards to training me in those areas that I was so passionate about.
Yeah.
And, after residency, I joined a very busy practice where it was a traditional practice where I was going to 6 different hospitals on call every third night, seeing 30 patients a day, rounding in the ICU, just, practicing cookie cutter medicine because I only had about 15 minutes per patient. Right. And then I was 8 months pregnant, and I tragically lost my baby to a really rare phenomenon called maternal fetal hemorrhage, where basically the barrier breaks down between mom and baby. And so she essentially bled out in me. We did an autopsy. She was completely healthy, no genetic abnormalities or anything. And I largely attributed her loss to the fact that I was stressed, not properly taking care of myself, and not really listening to my body. I was on call right before, I lost her. But it was really that disturbance that forced me to wake up.
Right.
And I stopped rounding in the hospitals. I found my fellowship in anti-aging and regenerative medicine. I took a day off a week to do my fellowship, and would later become certified in anti-aging regenerative medicine, and then board certified in integrative medicine. And it really catapulted, that tragedy, as horrible as an experience it was, it catapulted me to practice the type of medicine that I'm so passionate about. So
wow, what a story.
Grateful for I'm grateful for that experience, because I don't know how long I would have continued to just kind of practice the medicine that was really essentially burning me out and causing me to be sick myself.
Right. And you see that so much in our medical field. Healthcare providers taking care, of patients aren't taking care of themselves, and that's because of the way it's really not healthcare. It's sick care. And it's, what the insurance companies will, cover. And it's really not about looking at what this patient needs, and being able to have the time because they're so pressured, right, with all the other burdens. And so, yeah, sometimes it is unfortunate, you have a tragedy like that, but you listened. Oftentimes many don't. And they continue on that path. And so it's great that, not only for you, but for so many, patients that you get to help, which I think is a gift, really.
Absolutely. Absolutely. We're forever grateful for, the path that it steered me down. So,
So now you have a center and you have
yes.
other physicians and healthcare providers. So tell us a little bit about the Forbes Longevity Center and, kind of about what the experience and what you're bringing to patients.
Awesome. Well, so it was originally Massey Optimal Health Center. The founder of the practice started in 2005, and it first was kind of an executive health physical. So the goal was to see and treat only executives, and it consisted of a full day evaluation, very thorough testing. The founder himself was really into preventive medicine and nutrition. He was a certified nutritionist and certified chef. And so he really threw in kind of his own wellness and preventative medicine aspect to it versus, if you get executive physicals elsewhere, they don't always really put the emphasis on nutrition, lifestyle, supplementation, sleep, stress management, all of our 5 pillars that we talk about. And I had actually met him when I was in residency. I saw him lecture in San Diego, and I was just blown away with how much he knew about prevention and so forth. And it was like a standing room only. His lectures were standing room only because he really was ahead of his time at the time. Not a lot of people were talking about reversing diabetes with lifestyle.
Right.
And so I was I was in residency at the time in St. Petersburg, and I looked up where his clinic was, and lo and behold, it was in St. Pete.
Yeah.
And so I called him up and I said, can I rotate with you as a resident? And he was so gracious to let me rotate and shadow him. And he had been recruiting me ever since. But I was on, it was from Canada on visas. So my situation was a little more complicated at the time. But then also I wanted to get more training.
Sure.
And so fortunately, several years later, I had that training and I bumped into him. I kept bumping into him. I think it was just fate. And
yes,
he was really looking for a partner at that time, this last time. And so I bought into the practice and joined him as a partner. And so I've been here 6 years. And so yes, our practice is very unique. As you know, we spend a full day with our patients when they first come to see us. And I spend a whole hour learning their history. We practice very personalized medicine. So everyone has their own story.
Yes.
And so I want to really take my time to do a thorough intake. And so I spend at least an hour with them, learning their history, spend an hour with their physical, do carotid IMT, so measuring their vascular age and looking for plaque in the carotid artery, because there's a good correlation between what's here and what's here. We do exercise treadmill testing with VO2 max. That's how efficient your body is at utilizing oxygen, and that correlates to longevity as well if you've got great VO2 max. We do cognitive testing, fitness testing, spend a whole hour on their nutrition, looking at supplements as well and where they're falling short in terms of their diet. We do a ton of advanced biomarkers for aging in terms of blood work.
Yes.
Look at body impedance scores and so forth, looking at visceral fat, percentage of body fat, muscle mass, and so forth. And then we add on any additional testing they may need, which again is very personalized. If they're having gut issues, we're looking at the microbiome, looking at digestion, looking maybe at genetics, maybe ordering a CT angiogram of their heart to look further at, plaque. And we take that a step further and send it for artificial intelligence to look for, lipid-rich necrotic core plaque. That's that plaque that's just ready to rupture. So all these testing to really get ahead of the curve. So some of them are just, to have kind of a baseline.
Right.
And then some of them are to kind of detect disease earlier, so we can help reverse it. And using a very personalized, precise approach and functional medicine approach. So
Yeah, well, I could say firsthand, I mean, when I came to you, I know I had all sorts of gut issues. You had diagnosed me with H. pylori, and that I had for a long time. And finally, yay, this year when I came back, it was gone.
yeah.
And, that is because, you listened, you did very, personalized testing to try to really help me figure out, what was going on. And then really without having to be on medications, it was really just about, the right supplement combination. And, that did it. And so, I appreciate how, the approach is not just like, okay, like, you come in and you look at one or two things, like when you go in and you have a physical, it's very, very different than, what you guys do, which is really looking comprehensively, like you said, from a preventative perspective. You're just looking at all these different aspects, obviously from your experience and your training. So you're getting a nice baseline and then seeing, okay, like where do we need to dive deeper, and then helping people, navigate and live their best life, right? Because so many people are living with disease and all these things that, that is basically they're just given a medication, or told that they have to have surgery, as opposed to these alternative or proactive approaches, which is what I love. I mean, I remember my first, physical with you, I was just blown away. I was like, how come everybody doesn't get this? Like, this is just, I mean, it just seems kind of criminal that, that every person doesn't have access to this wonderful approach, to their health. So I'm grateful that there are people like you in our community that are offering this. It's really, especially now, it seems more than ever, medical practices are busy and insurance is driving things more and more. And I hear from my patients all the time, they're frustrated. They're being shuffled from this place to that place and nobody's getting answers. Nobody's sitting and listening to what patients are saying and helping to put these pieces together. So yeah, it's
so true. Well, and I think I'm still so passionate about health and prevention. And so I'm constantly reading because, the latest and greatest is always coming out, or like medicine's evolving, right? And I think too many of my colleagues in the community are so burnt out.
Yeah.
That's the last thing they want to do.
That's right.
Is go home and read about medicine. No, that's like my favorite thing to read about, know. But I say 15, 20 years ago when I was in the grind,
you were exhausted.
I was too exhausted. I was too burnt out. So I think that yes, I'm very, very fortunate to really truly love what I do. And I really feel like it's more of a mission than a job.
Yes,
really
that is so true, right? When you come from that place, you just want to try to, carry this out, of, how you live your life. And I know we've talked about that, the things that, you do and you've tested, and I'm the same way, before I'm going to have a patient do it, or I'm going to recommend it to a patient, I'm like, okay, let me try it. Let me see how this is working for me. And, then you can, you can speak from experience and, yes, this is actually, is really making a difference.
Absolutely. And you have to be realistic about things, I don't push anything that I'm not willing to do. I consider myself like to be a role model in healthcare to my patients, but
Yeah.
there's some things like I'm not even willing to do. So I'm not expecting my patients to do some things that are just over the top.
Yeah. Yeah.
Unless they're super uber motivated, more so than I, but
Well, and I think, as a healthcare provider, we have to meet people where they're at, and sometimes they're not ready to
yeah,
take that step. So, we meet them where they're at. We start somewhere, and then, year by year, hopefully, they see the benefits and they're more willing to do those things. I know we've had those discussions, about
yeah,
again, just have to kind of meet people where they're at.
absolutely, absolutely. And I say to some patients, like Rome wasn't built overnight. I
Right.
realize and appreciate this,
Yeah.
So stay patient, just chip away with
Yes.
the lifestyle changes and just check them off one by one and just continue to build, right? The more that we can implement in terms of lifestyle, the better. I mean,
Yeah.
80% of diseases really can be prevented with lifestyle. We don't
I
make that
know.
emphasis enough. Um, you know, COVID should have really taught us a lesson there. We
Yes.
did not send that message enough.
Yeah.
That, one of the biggest mortality risk factors was obesity.
Yes.
Why we weren't talking about lifestyle and what we could do to prevent death from or poor outcomes from COVID is just, it's criminal to me. So
Yeah, it's so true. And I think what you said, the little changes, right? Like
yes,
when you and I met, we talked about, okay, there's lots of different things that, you can incorporate, but like, let's just pick a couple things and let's just do those really well. And, within just 1 month, I'm starting to see changes, right? And
yeah,
again, it's not overwhelming. It's just, a little bit at a time, and a little bit goes a long way.
absolutely,
Yeah.
absolutely.
So let's talk about maybe some tips that you have for our listeners about how to get those great outcomes. Because I
Yes.
know that you do.
So, well, you really want to know your numbers. You want to get a really good foundation and baseline.
Mm,
Because I really found that trends are everything. And,
mm,
often I'll have my patients come in with their previous records and previous numbers so we can really track, and then we continue to track in the trends, right? Because
yes.
even simple blood work like a neutrophil slash lymphocyte ratio, that's an incredibly important ratio that is found on a very basic lab called your complete blood count with differential.
Mm-hmm.
And that tells us how our immune system is aging. It also tells us, assesses for inflammation.
Yes.
And, as we've talked about, the new buzzword out there is called inflammaging, right? So all the diseases we succumb to is related to
Inflammation.
inflammation.
Yep.
And so if we can put out the fire, that really helps protect our brains, our hearts, our tissues against cancer, protects our immune system against serious infections. So really knowing your numbers, including inflammatory numbers. And all
Yeah.
these numbers are, a lot of the doctors check them,
Yeah.
your standard blood work. And
Yeah.
so really, really, but being your own advocate and
Yeah.
understanding your own numbers. But certainly it's helped my patients'
Yes.
outcomes because we pick up these subtle changes
Yeah.
really early, right? And then we
Yeah.
look for disease,
Yeah.
and before it becomes too late.
Yes.
So know your numbers. Go to a physician. This is the advice I would give, but certainly functional medicine and
Yes.
integrative approach has certainly helped the outcomes of my patients. So, but I
Yes.
would say If you can't come see myself or one of my practitioners, seek out someone who is going to get down to the root cause of
Yes.
disease and use an integrative medicine approach. So, looking at nutrition, looking at fitness, looking at sleep, stress.
Yes.
Stress is the silent killer.
Yes.
Truly, and that sympathetic dominance.
Mhm.
Majority of us are being chased by a bear at all
Yep.
times of the day.
It's so
right?
true.
And a lot of us can't upregulate or have a difficult time upregulating your parasympathetic system, that rest and digest system.
Yep.
And it's all about balance, right?
Yes.
So someone who's focusing, who's testing your ability to relax and upregulate that parasympathetic system,
Yes.
looking at your heart rate variability, looking at your toxic load. So really seeking out a practitioner that does that. And that's what we do, in our practice is we look at those 5 pillars of health, looking at hormones as well. I've forgotten to mention hormones, but that's part of
Yes.
it. I always think of that as stress and sleep because, I always think of cortisol with stress, which can affect all your sex hormones.
Absolutely.
So those are a couple things that have really improved the outcomes of my patients. Doing advanced testing when needed, looking at the gut, looking at advanced cardiac measures.
Yeah.
Maybe doing a CT angiogram. I did a CT angiogram of one of my patients, sent it to Clearly Health with artificial intelligence. And he was asymptomatic, did not have any symptoms of angina. He had 100% occlusion of one of his main arteries, his left anterior descending, which is the widowmaker. And he was walking around functioning fine, had no clue.
And you picked that up
through. The reason why we checked that is because he had persistently elevated CRP, high sensitivity CRP. His cholesterol wasn't that great, but this was a guy who's functioning very well, business owner, and had significant blockage. And so fortunately we sent him to TGH. He had a robotic bypass and he's doing exceptionally well, but he didn't realize, he wasn't in tune with himself enough to realize he was actually having some symptoms. He was more fatigued with exertion, but certainly never came to see me. So having a hunch and then doing some advanced testing such as that can save lives. Doing there's a test called the Gallery test, which checks for microcancers, screens for microcancers in the body, up to 50 different cancers.
Wow.
So that's a test that we do on some patients, certainly if they're at risk. It's not a cheap test, so I've made it more optional for my patients. It's $900 or so. But that's a fantastic test. So it's great. It has the sensitivity of about 85% for esophageal, which my dad died of esophageal cancer, and pancreatic cancer, which those two are like silent killers, right? So yes, doing it, asking your doctor for advanced testing, if things just don't seem right and you're not getting answers.
Yeah, and realizing that sometimes these types of treatments, these types of testings may not be covered by insurance, but unfortunately, the way that the healthcare system is they're reactive to somebody like your patient who comes in, then they've already had a heart attack, right? That's the only way it's identified, is that they've actually had a heart attack. And, are they actually able to get in time that they don't die? And, you're able to, with, doing, and investing in our health. And I just think it's so important, because you can pick up on these things and then you can put preventative measures, and save, a life that probably, if he had continued to go on without that, he would have had a major heart attack.
Yeah, no.
Could have been fatal.
It's pretty amazing. And that the CT angiogram, I mean, I send a ton of my patients to Dr. Alberto Morales in Tampa. He's phenomenal. He's a cardiologist himself. He actually does the CT angiograms at his office. It's $400. The insurance does not pay for it. We've tried.
$400.
You know, $400 to get the
Wow.
additional artificial intelligence reading. I think it's an additional $900 if you know, which I'd recommend, but that's $1,300.
Yeah.
Maybe even, you know, if you stop at the just regular CT angiogram, which is still a fantastic study, $400.
Yeah.
Yeah.
It's just it's a mind shift. It really is, because I think, and I've seen this, and I know you've seen it with your patients, is that, you know, oh, I'm paying for this insurance, like I should go somewhere, you know, yes, but you know, oftentimes this type of care is not really given to that level, because the insurance companies oftentimes don't cover it, or they make you jump through so many hoops, you know, before you can even order a test like that, and that may be too late.
Yes, no, exactly. So that's why, you know, it's funny. I had a dream last night that somehow my practice got sold, you know, without me even knowing.
Oh,
And I had to
God.
go back. I had to go back to my old
Oh, no.
clinic, and I had a list of patients this long. They were out in the waiting room, like, you know, disgruntled and so forth, because I was taking too long with my patients. And it was a nightmare. Like, I woke up and
You don't sweat. I've had those dreams too, like I was back on the tour, and yeah, you know, you got like all these people, you know, these athletes that you're trying to treat, and I know it's crazy.
Now, you know, we really try and create experience for patients, and you know, I can spend as much time as I want to figure, you know,
Yes,
to the bottom of their health. So
yeah, and that's the beauty, and that's so great, and I so appreciate it. Well, I know you teach your patients every day. So was there any advice that you can give our listeners on things that you have taught others that people really appreciate, specific to you and how you deliver your care to your patients?
So again, know the numbers, make sure that you're with a practitioner who's taking a personalized approach. You know, look for a doctor who's going to be empathetic and give you some grace. That's a big, you know, if I ever reflect on, you know, outcomes that I wish I'd gone better, it's usually my sense that I didn't take enough time with the patient, or I didn't make that extra phone call, you know, and so I'm constantly myself trying to better myself as a human being and as a physician. And you really want to find a practitioner that's going to be humble and admit when they're wrong, or and really care for you, you know, like I can truly say, and it's going to make me tearful, but I love my patients, you know, and we really love them. We it feels like a family.
Yes.
You know, from our staff to our patients, it feels like a family. And so that's what I would say is seek out a practitioner who is going to be open-minded to ordering some of these tests, who you can feel comfortable, you know, carrying on a dialogue with your concerns and different testing you want to do. Because too often I've had patients say that they went to their primary care doctor, and the doctor just rolled their eyes at, you know, at them, or you know, looked at their problem lists and just rolled their eyes and huffed and puffed and didn't even look at them during the exam. And that to me,
It's heartbreaking.
it's heartbreaking. Like, that's criminal. And I will say, I do feel sorry for your doctor who is, who's stressed and so forth. But even in my darkest days, I still cared about my patients and still was open-minded. If there was something I didn't know about, I said, okay, I'll read about it.
Right.
I'll read
I'll
about it
figure
and
it
get back
out.
to you.
That's right. If you don't know, just say that and say, but I'll find out, or I'll find somebody who does, right?
Yes.
Yeah.
So
It's really a partnership.
It's a partnership.
Right.
It is a partnership.
Yeah.
It truly is. And I take that job, seriously, that partnership seriously. And so I urge, listeners to really, really look out for that doctor who's going to be your partner in health.
Yeah.
I will also say, be your own advocate.
Yeah, right. If
don't assume that all doctors have the answers.
Right.
I'm reading a very enlightening book right now, but it essentially talks about how, we can't always trust our governing bodies and our medical system to lead us in the right direction. You have to be your own advocate and read. And, COVID certainly taught me a lot about that.
Right.
I knew that prior to, but it's just really opened my eyes.
Yeah.
To, the fact that we really, really have to be our own advocate.
Yeah, I think that's so true.
Go for, and go to a practitioner that's going to be, again, open-minded and treat you like an individual and not just treat you like another number.
Yeah. Yeah, it's so true. And unfortunately, so far and few between where we're able to find those practitioners, like yourself. And so I thank you for being in the community and for, helping me with my health and, the patients that I've sent to you. So I love collaborating and, learning from you. So thank you so much. So tell our listeners, is there anything else of value that you'd like to share?
Maybe just that I'm a person as well, and I'm a mom of 3. So after my tragic loss, I had 3 healthy babies. They're my little pride and joys. My 2 daughters are synchronized swimmers, and they're taking after their mom. I did synchronized swimming.
You did, and now you're coaching, right?
Yes, and now I'm coaching, and my little boy, is just gives me a run for my money every day, but is keeping me young. I'm just boys are very different.
And you just got a dog, right?
Oh yes, we did, and yes, so he's a dachshund. So he's a doxy poo, so he's half dachshund and poodle, miniature poodle. So yes, we share the love now for dachshunds. So,
yeah, dachshunds rule.
So yes, and we are, I'm passionate again about prevention and wellness and so forth. We're into peptides too and bioidentical hormones, and we're taking new patients. So if you, your listeners need a good primary care, they can call our office, and we'd love to be a part of their healthcare.
I would highly, highly encourage anybody who's looking for a primary care, who really wants to take charge of their health and wants a partner in that journey. I would highly recommend that they give you a call for sure. So tell the listeners how they can find you. I'll definitely put your information in the show notes, but maybe just let them know the best way that they can get in touch.
So they can look us up at ForbesLongevityCenter.com and reach out to Angie. She's our patient care coordinator. So
wonderful. Well, thank you so much for your time. I so appreciate it and all that, you do in the community. So, yeah, so until next time, keep getting
Thank
good outcomes.
you. Thank you so much, Lisa. It was my pleasure. Thank you,
Thank
guys.
thank you.